is wealth, they say. And when you're healthy, you are wealthy. So in all situations, in anything you do, what you need to do is look for a better way to be healthy so that you will be wealthy. You know one thing, those money, when you are healthy, you won't be able to spend much in the hospital. Then when you are healthy, you'll be able to work all your day-to-day activities and you live a fulfilled life. That is what is leading us to our first guest this morning. Our first guest is Dr. Aladesuru. I call him Young Papa. There's Papa there, there's Young there. So he is the medical director and the CEO of Olutunde Medical Center, Akure. Papa, you're welcome. Fine boy.
Thank you very much.
How far? Yeah.
Very good.
Oh,
Okay.
yeah, give me your five now. High five.
Thank you. Thank you. And that is extended to our viewers at home.
Okay, see, that high five is for everybody. So, doctor, how has it been?
Oh, well, thank God.
Our
We're
patients
coping.
will go.
And do well alone.
Sure.
Sure, sure,
Uh,
sure.
Tunde, key papa. Key doctor.
Welcome to our program, Ms. Grill, Dr. Aladesuru.
It's nice seeing you. I'm meeting you. I'm working with you. You're
Okay.
welcome too.
Okay. Thank you. Well, today we want to talk about typhoid fever. It's a household name.
Yeah.
It's a name that even when a young child knows, typhoid fever, Jamie. When we talk about typhoid fever, what actually are we really talking about?
Yeah.
Typhoid fever, typhoid fever.
Uh, Typhoid fever is one of the very many fevers that we have that affects the human race. Now, when I say fever, fever alone means an increase in the hotness of the body. If you want to put a little bit technical, you say it's a hotness of the body and then temperature. That's the technical term. But for typhoid fever, which I can call the household name, and people misuse a lot. When people have fever, there could be various forms of fever. The commonest of them is malaria fever. For those of us in the tropics, that is between the Tropic of Cancer and the Capricorn, if I still remember, that's a very common one that is caused by the mosquito, which does not live in the other areas of the world. Now, when we talk about typhoid fever, it is a bacterial infection. The infection we have in the body made up of main three reasons: bacterium, or the plural, which is bacteria, fungi, and virus. These are infections. Infections, in simple terms, are things that are caused, illnesses that are caused by the body by external factors. And some of these are so tiny, local people cannot see them with the naked eye. And that of typhoid is caused by a bacterium that is called typhoid bacteria. And there is a particular one because when someone has fever, and the fever that is caused by typhoid is so high, much higher than those of malaria.
We are coming to that. You're just trying to tell us that there are different types of fever.
Yes.
So typhoid
yes.
is one.
One of them.
And
yes.
We have malaria fever. We have
yes.
typhoid fever.
Yes.
Now, if we want to go further to ask, what are the symptoms of typhoid fever? That because it looks like. Abi, do you have one question you want to ask, Papa? No, go on.
I was going to ask, what are the symptoms Nigerians should never ignore?
Okay.
Talking about typhoid.
Okay.
What are the symptoms that Nigerians should never ignore?
Yeah. Like the questions that both of you asked, the symptoms, that is, these are the things, those are the signs that you see in you that will make you suspect that you have typhoid. The poor thing, I'll call it poor, is that there are symptoms or feelings in the body that cut across a gamut of infections, including malaria fever, which I said is one of the commonest form of fevers, headache, hotness of the body, feeling of unwell. Someone who gets up and you're a farmer, you are a seamstress, you are a teacher, you are a civil servant, and you can go to your work, you find it very difficult to get up. There is inability to eat. There is low or poor appetite. There is abdominal pain in case of typhoid fever. There is abdominal pain, and then there is a sign that might be a horrible one. There could be either constipation or diarrhea.
Okay. If we are to ṣàlàyé gbogbo ẹ̀ ní Yorùbá o.
Yep.
But I want to ask this now. If we are to categorize it, àwọn wo ló máa ń sábà suffer jù? What's the category? Is it the children? Because in some of the range that we have here, 5 years, we have like 25 to 30% of children suffering from typhoid fever.
Yeah, when we talk about this symptom, I just want to add one, which is very, very specific. I will call it rose spots. Those rose spots are very, very typical of typhoid. It either appears on the chest or in the abdomen.
What does it look like?
You have to see it to be able to appreciate it.
Advocate
eye. Spot. It's a rash, a particular rash, and it comes. They are either eccentric, that is in circular, not a perfect circle though. You have it on the body.
How often do we see such thing?
In an advanced case of a typhoid fever, untreated one, because most of our people, because of lack of knowledge and education about ailment, once you have fever, you take one of the drugs that will bring down the fever. It will bring down the fever and it will come up again. Because the root has not been dealt with. Now, talking about the category of people, there is no one that typhoid fever cannot affect. I want to say only those whose body the germ cannot enter are the ones that will not be able to. And in most infections, if not all, what we call the extreme of ages, the young, babies, child, adolescent, and the very old, from 65, 70 and above, are more affected than the able-bodied people. It can affect every age, no sex difference, either male or female, and anyone that comes across the infection can be affected. Yeah.
Okay. Dear viewers, wherever you are watching this program, it's Mixed Grill, and we're talking about typhoid fever. This morning, we're paying host to our doctor, Dr. ALADESUIRU, the medical director of Olutunde Hospital in Akure. Doc, a fẹ́ kẹ́ ṣàlàyé ní Yorùbá typhoid fever. Àwọn kan ní omi tá à ń mu pé tá bá ti mu torí ẹnìkan bá ti lè lọ hospital tó dé báyìí náà ní typhoid fever ló ṣe tó àìrà ẹ̀ ti yá tán báyìí ló bá do ní bottle water gan kì í ṣe just any bottle ó tún lórúkọ ìkàntán ní dandan eléyìí lòun ó máa mu torí wọ́n ti ní typhoid. Ẹ gbọ́ ṣé omi ló máa ń gbà wọlé ni níbo ló máa ń gbà wọlé?
Ẹ ṣe olóòtú, ó ń gba omi wọlé dáadáa. Pàtàkì jùlọ nǹkan tí olóyìnbó ń pè ní typhoid fever táwa ń pè ní ibà jẹ̀fun. Ó ti o jẹ̀fun
lélẹ̀ báyìí.
bẹ́ẹ̀ ni jẹ̀fun
kò jẹ̀dọ̀
tó bá dé ibi tí ó ti ní orúkọ yìí àtúnṣe wà o, ṣùgbọ́n a lè sọ pé ọ̀run lẹ̀rọ̀ nítorí pé ó máa ń dá hòlù sí inú ìfun wa. Ní èdè tòyìnbó àsọ̀rọ̀ débẹ̀ lẹ́ẹ̀kan wá ní typhoid perforation. Ẹni tí ó bá ní irú eléyìí àti pé kó rù ú là á dé ilé ìṣègùn tó ti lè ṣe iṣẹ́ abẹ tó ti lè wò ó dáadáa.
Wọ́n túmọ̀ sí pé typhoid lè pààyàn.
Ó pààyàn dáadáa. Lóyìnbó a sọ pé it's a deadly disease. Yes. Irú mo ń gbìyànjú láti rántí kòkòrò tó ń fà á ní èdè Yorùbá ọ̀ ní salmonella typhi. A sì lè pe omi salmonella paratyphi. Eléyìí àwọn onímọ̀ ẹ̀rọ wa tí wọ́n ń yẹ ìtọ̀ ìtọ̀ omi ara ẹ̀gá àti gbogbo yòókù tí wọ́n ń yẹ̀ wò wọ́n mọ bí kòkòrò yìí ṣe rí tó bá ti rí lára ẹni tó ní ibà yìí. Ibà jẹ̀funjẹ̀fun yìí ó sì burú nípa pé kì í lọ kì í tiẹ̀ lọ bọ̀rọ̀ tá bá ń ṣe ìtọ́jú ẹ̀ tí pẹ̀lú òdiwọ̀n tá fi ń wo bí ara ṣe gbóná tó òdiwọ̀n tá à ń lò yìí tá à ń fi nǹkan kékeré sí abíyá tàbí sí tó bá jẹ́ àwọn ọmọdé sí ọ̀nà ibi tí wọ́n ti ń ṣe gá tàbí sí abẹ́ ahọ́n ó máa ń ṣe bíi mẹ́tàdínlógójì sí ó lé tíntín ṣùgbọ́n ní ti ibà jẹ̀funjẹ̀fun ó lè lọ sí méjìdínlógójì tá a bá ń fún lóògùn
ara máa gbóná fò.
lẹ́yìn ìgbà tá a bá tún wò ó lè lọ sí mọ́kàndínlógójì nígbà tá a bá wò ó tájẹ̀ tó ń fògùn sí ó lè lọ sí ogójì ó lé eléyìí á ti fi hàn wá tá a bá ṣe oògùn ká pé mo wo eléyìí bá ya àwòrán kékeré akànfàlà tá a máa ṣe torí tí àwọn oníṣẹ́ ìṣègùn wa pàtàkì jùlọ àwọn nọ́ọ̀sì wa tó bá ń ṣe bí ara ṣe gbóná tó yìí wọ́n máa ń sà á lo ọ̀rọ̀ yẹn wọ́n máa ń sà á sórí pépà tí wọ́n bá wò wọ́n wò báwo ló ṣe rí láàárọ̀ báwo ló ṣe rí nírọ̀lẹ́ ó lè lọ́ọ́lẹ̀ láàárọ̀ gbogbo bá di ìrọ̀lẹ́ a tún lọ sókè a sì ń fọ́ irú èèyàn bẹ́ẹ̀ tá a bá ti rí eléyìí a ti mọ̀ pé ibà jẹ̀funjẹ̀fun ni ó sì ṣe tó jẹ́ pé tí irú ẹni bẹ́ẹ̀ ò bá gba ìtọ́jú tó péye tó bá ti dáhùlù sí inú ìfun wàhálà dé o à ń múra láti jẹ́ pé kí olúwẹ̀ kó lè rí torí ìyẹn máa la iṣẹ́ abẹ lọ á di pé ikùn yẹn wú kò lè jẹun kò lè ṣe gbogbo nǹkan tó bá pátápátá eléyìí ó burú púpọ̀.
ó tún jẹ́ ó gbọ́ Yorùbá ó gbọ́dọ̀ fi Yorùbá béèrè ìbéèrè lọ́wọ́ dókítà wa lọ́wọ́lọ́wọ́ báyìí láwọn nǹkan tó bóyá àwọn ìgbésẹ̀ àtàwọn nǹkan mi ó yá kí ni ìbéèrè títí ẹ̀.
Tá bá sọ̀rọ̀ nípa typhoid fever yìí ìyẹn àrùn jẹ̀funjẹ̀fun kí ni àwọn ìgbésẹ̀ tí àwọn èèyàn lè gbé láti kápá àrùn yìí.
Ìbéèrè tó ṣe pàtàkì ni ìyẹn gan ni ìmọ́tótó wa torí ibi tí àrùn yìí ń gbà wọlé gẹ́gẹ́ bí wọ́n ti sọ lẹ́ẹ̀kan omi àti oúnjẹ lọ́pọ̀ ọgbà ló jẹ́ pé tá a bá ń ṣe ètò yìí mo máa ń sọ àwọn oúnjẹ kan tí a kì í sè tàbí tí a kì í gbé kaná tí ọ̀pọ̀lọpọ̀ ò kì í fọ̀ ẹ má ṣì mí gbọ́ o mi ò ní nǹkan kan ṣe pẹ̀lú àwọn tí wọ́n ń ta irú àwọn oúnjẹ báyìí àkókò tá a bá ní ọsàn àgbálùmọ̀ àkókò tí ìgbá wà ń ta nísìn tí àwọn èèyàn ń jẹ ìbẹ́pẹ tí àwọn kan ń pè ní dẹ̀mdẹ́ àwọn kan ń pè ní ògòlòmọ̀sí táwọn kan ń bẹ àmọ́rú omi tó ń fi ṣe wọ́n ọsàn èyí tá à ń mu oríṣiríṣi ọsàn ẹlòmíì tó bá ti rà á báyìí kó dì í mẹ́nu kó fi eyín já kó máa ṣe ni àmọ́ bí tí wọ́n ti ṣe léyìí gbogbo ibi tí wọ́n ti ṣe tó mi ò bá ṣe dáadáa ìyẹn láti fi hàn wá irú ìgbé ayé tó yẹ ká máa gbé nípa ètò ìlera wa àwọn tí wọ́n sì ní àrùn yìí lára kó tó di pé ó di ńlá tí wọ́n bá lọ sí ilé ìgbọ̀nsẹ̀ láti ṣe ìgbọ̀nsẹ̀ tí wọ́n bá tọ́jú ọwọ́ wọn dáadáa ó lè wà ńbẹ̀ mo máa ń sọ eléyìí lọ́pọ̀lọpọ̀ gbà bẹ́ẹ̀ ni níbi tí agódé yìí pẹ̀lú àwọn tó ń gbọ́ wa báyìí àmọye èèyàn tí a ti bọ̀ lọ́wọ́ láàárọ̀ yìí.
èmi gan ti ṣe high five sí yín gan
lẹ́ẹ̀mejì
a sì mọ kínní.
ẹni tó bá ti ṣe torí ọ̀pọ̀lọpọ̀ tó ń bá fọ ọwọ́ wọn dáadáa a ní nǹkan tá a lè fojú rí ni tó tún máa ń sọ ọlọ́pọ̀ ọgbà ọkọ̀ kéékèèké tó máa ń gbé èèyàn kiri tá à ń pè ní taxi àmọye èèyàn tó ti ṣílẹ̀kùn ẹ̀ láàárọ̀ yìí tó ti wọlé tó ti jáde tó ti ṣílẹ̀kùn tó ti jáde táwa náà bá wọbẹ̀ níbi ilé iṣẹ́ wa àbá jẹ́ ọ̀gá àbá jẹ́ ọmọọṣẹ́ ibi tá a ti ń ṣe gá àmọye èèyàn tó ti ṣílẹ̀kùn tó ti ṣe àwọn kòkòrò yìí ó wà ńbẹ̀ ohun tí a ti ṣe àyẹ̀wò ẹ̀ ni níbi a ṣe ń sọ̀rọ̀ yìí ká mú nǹkan kékeré ká fi wo àwọn lẹ̀kùn tí à ń sọ yìí, ká wò ó lábẹ́ ohun tó mú nǹkan tóbi á yà wá lẹ́nu. Ọwọ́ wa pàápàá pé ká wò ó, ẹni tó ti fọwọ́ láàárọ̀ yìí láì lo àwọn nǹkan tó máa ń pa kòkòrò tá à ń fi pa ọwọ́, gbogbo ọ̀nà yìí ni èèyàn lè gbà láti fi kó àrùn yìí. Pàtàkì jùlọ gẹ́gẹ́ bí wọ́n ṣe sọ ọ̀rọ̀ omi, ìmọ́tótó ṣe pàtàkì.
Ní malaria, normal malaria ọ̀tá ní kíní, a rí i pé wọ́n ní ẹ̀fọn bá ti gẹ̀yàn o yóò ti ṣe kíní o, wọ́n ní ẹ̀fọn ló ń gbé yẹn kiri. Ìyẹn wá túmọ̀ sí wípé kòkòrò àìrí tá à ń wò tó ń gbé typhoid káàkiri yìí ó lè mú ẹnikẹ́ni. Ṣé ó máa ń ranni ni? Is it transferable, or ṣé a máa ń jogún ẹ̀ látọ̀dọ̀ àwọn òbí wa? Ẹ mọ̀ bóyá is it hereditary or is just transferable? Do we
àjogún ẹ̀ kì í ṣe àwọn àìsàn, ṣùgbọ́n àìsàn tó lè ràn yàn ni. Nínú ilé tó bá mú ẹnìkan tí wọ́n bá ṣe ìtọ́jú ẹ̀ dáadáa, pàtàkì jùlọ ọmọ kékeré èyí tó jẹ́ pé ìyá ẹ̀ máa ń gbé, ó ń fi ọwọ́ sẹ́nu, ó ń ṣe gbogbo ẹ̀, tí ó lè ran ìyá, ó lè ran ẹ̀gbọ́n tàbí àbúrò ẹ̀ nípa oúnjẹ. Torí omi tí à ń mu àti àwọn nǹkan tó jáde lára ẹni tí ó ní àìsàn yìí ó lè ran ẹlòmíì, ṣùgbọ́n kì í ṣe àjogúnbá.
Kì í ṣe àjogúnbá. Tí a bá wò asọ́lẹ̀ kan ní èdè Gẹ̀ẹ́sì, àwọn wo ló dàbí ẹni pé wọ́n wà at risk jù tí àìsàn yìí máa ń sábà dé bá? Torí wọ́n ń lọ ilé ìwé, wọ́n dé malaria lásán ló ń ṣe, àdẹ̀tírìtì malaria yóò sì lọ. Ṣé ó lọ́ọ́ fojú pamọ́ ni? Àwọn wo náà wà at risk jù nínú àìsàn yìí?
Kò sí àwọn tí àìsàn ibà jẹ̀dọ̀jẹ̀dọ̀ ò lè mú, ṣùgbọ́n ó lágbára lórí àwọn kan ju àwọn kan lọ.
Àwọn wo ló lágbára lórí wọn?
Ó lágbára lórí àwọn ọmọ kéékèèké àti àgbàlagbà tó ti pé 90, nítorí pé ohun tó ń dènà àìsàn lára wọn kò lágbára. Tọmọdé kò tí ì dàgbà tó, tí àgbàlagbà ó ti lọ́ọ́lẹ̀. Ṣùgbọ́n ní àwọn tó wà ní agbede méjì yẹn kò lè mú wọn bákan náà. Nínú ibi tá a wà yìí, tá a bá tó 5, 6, 10 tí mo fi eléyìí ṣe àpèjúwe, tí ẹ̀fọn tó bá jẹ gbogbo wa bákan náà, kì í ṣe gbogbo wa là á ní àìsàn yìí. Ohun tí mò ń gbìyànjú láti ṣàpèjúwe ni pé
àwọn sójà tó wà lára wa jàjúra.
Bẹ́ẹ̀ ni, ẹ ṣeun. Ẹlòmíì kò tiẹ̀ ní mọ̀ pé nǹkan kan ṣẹlẹ̀, nítorí pé àjẹsára tó ti ní yóò bá àìsàn yìí jà.
Bàbá, gẹ́gẹ́ bí ọ̀rọ̀ àjẹsára tẹ́ sọ yẹn, ṣé kò sí àjẹsára tó yẹ ká máa jẹ, pàápàá jùlọ ṣe mọ̀ pé bírú nǹkan tá a gbé sí ojú àwòrán wa yìí, àwọn ọmọ láti ọdún 5 oní percentage tiwọn, àwọn ọmọ tó jẹ́ pé wọ́n wà ní ọdún 5 sí 14, ẹ rí i pé bí 30 sí 35 ni. Ẹ wá wo àwọn tó wà níbi ọdún 18 dé 24, ẹ rí i wípé àwọn náà tó dàbí pé ó tún wá sókè díẹ̀. Ṣé kò sí àjẹsára tó yẹ ká máa gbà, bóyá wọ́n ṣe ń gba àjẹsára fún measles tó ń gbà fún polio? Ṣé kò sí àjẹsára tí àwọn onímọ̀ ìjìnlẹ̀ ti wá jáde fún wa?
Ó wà fún
typhoid.
Bẹ́ẹ̀ ni, ó wà, ṣùgbọ́n kì í ṣe èyí tá à ń gbà gẹ́gẹ́ bí ti àwọn yòókù tẹ́ dárúkọ yẹn, gẹ́gẹ́ bí ikọ́ fèé, measles, yíkíyíkí, rọmọlápá, rọmọlẹ́sẹ̀, gbogbo àwọn wọ̀nyí náà ṣe gbà. Ṣùgbọ́n tí ẹnìkan bá fẹ́ lọ láti orílẹ̀-èdè kan sí orílẹ̀-èdè tí a rò pé ibà jẹ̀fun yìí wà, wọ́n á fún ní àjẹsára tí ò fi ní jàǹbá eléyìí. Àjẹsára wà fún ibà.
Ṣé kò ṣeé ṣe bóyá ní ìbẹ̀rẹ̀ ọdún kí n kàn wò pé mi ò fẹ́ kí bá jẹ̀fun ó ṣe mí o, kí n dẹ̀ ya ilé ìwòsàn, kí n dẹ̀ ní ẹ dákun ẹ fún mi ní àjẹsára kí n gbà sára yìí ná?
Ó ṣeé ṣe.
Ṣe
rí gbogbo àwọn àjẹsára yìí, ọ̀pọ̀ àwọn ìyá wa wọ́n máa ń béèrè nígbà tó bá wá ṣe ìtọ́jú oyún pé ṣe tá bá bí ọmọ lónìí yìí, òní jẹ́ ọjọ́ 26 báyìí, tá bí ọmọ, kó tó di ọ̀sẹ̀ kan ó ní abẹ́rẹ́ àjẹsára tó gbúdọ̀ gbà oríṣi 3. Òmíì ó dìgbà tọ́mọ yẹn bá pé ọmọ ọ̀sẹ̀ 6, òmíì ó dìgbà tó bá pé ọmọ ọ̀sẹ̀ 10. Kí ló dé tí ó ṣe? Òmíì wà tó jẹ́ pé lẹ́ẹ̀kan tá a bá ti fún báyìí ó tán, òmíì wà tó jẹ́ pé a máa fún lẹ́ẹ̀mẹ́ta. gbogbo àwọn nǹkan wọ̀nyí ni àyẹ̀wò ti sọ fún wa èyí tá à ń fún ọmọ ní kété tá a bá bí ọmọ láti òòjọ́ ìyá ò lè mú kí eléyìí ó wọ ara ọmọ àwọn kan wà tó jẹ́ pé àjẹsára ìyá ó wọ ara ọmọ tó jẹ́ pé ní oṣù mẹ́ta tí a bá bí ọmọ yẹn tí nǹkan bá ṣẹlẹ̀ pẹ̀lú irú àìsàn bẹ́ẹ̀ kò ní pa á lára ṣùgbọ́n lẹ́yìn yẹn tá a bá ti rí i pé agbára yẹn ti ń lọ́lẹ̀ láti sáré fún ọmọ yẹn àwọn àyẹ̀wò ti wà tó jẹ́ pé a ti ṣe irú ibà jẹ̀funjẹ̀fun tá à ń sọ kò sí ní ara àwọn àìsàn yìí àìsàn tí a sì lè ṣe aláìkóni tá a bá ṣe ìmọ́tótó wa déédéé gbogbo àwọn nǹkan tí mo sọ omi pàtàkì irú kòkòrò tó ń fà á yìí tí mo pè ní salmonella typhi nínú omi àti oúnjẹ bẹ́ẹ̀ ni àti oúnjẹ tá a bá ṣe dáadáa tó bá ní mo sọ ìkan lẹ́ẹ̀kan pé àgbálùmọ̀ mo sì lè fọwọ́ sọ̀yà rẹ̀ pé ṣé mọ̀ pé mi ò mọ̀ bóyá wọ́n ti ń gbin igi àgbálùmọ̀ tó bá ń gbé ayé òde òní nìyẹn tẹ́lẹ̀
inú gbóló máa wà
bẹ́ẹ̀ ni ó sì máa ń tóbi abẹ́ ibẹ̀ làwọn èèyàn tó ń lọ oko tó máa ń lọ ṣe gá èso yìí yálà akani o tàbí ó jábọ́ gá tó ti gbẹ tó ṣe a lè fojú rẹ̀ àmọ́ kankan ẹlòmíà tẹ̀ fi nu ara báyìí ó di mímú lọ nìyẹn irú àwọn nǹkan báyìí yìí ó ṣeé ṣe kó mú ẹ̀ńtọ́ tí ò bá ní ìmọ́tótó tó bẹ́ẹ̀ irú àwọn nǹkan yòókù tí mo mẹ́nubà bíi ìgbá tí à ń jẹ gbogbo ala fẹ́ràn ẹ̀ omi tí wọ́n lò láti fi ṣàn tó bá ní kòkòrò àbí kó ti jẹ́ pé ó ti pàdé ibi tí omi tí gá ti ṣe sí tó ṣe ó lè mú yàn.
Well, dear viewers, it's Meat Grill, and we're talking about typhoid, people that are at risk, everybody. But all we need is cleanliness. They said cleanliness is next to godliness, cleanliness is next to your good health. So I don't know how far you are clean in your house. And at the end of the day, let us just talk about some things, the treatment. Is it immediately you feel that your body is warm, this one you have some abdominal pain, we should be rushing to the hospital? Because sometimes we can just take some drugs and we'll be okay. So what actually are you saying with this now?
Well, I wanted to say to Yoruba.
Yes,
I would say it in both.
Yes,
what I usually say, whichever room you are, you cannot see where we are in this studio, but those people here will know and where you are. Whether your living room, your kitchen, there's a tap there, water tap, and it's just dropping. One drop, maybe one drop every 10 seconds, and you woke up in the morning and you saw your kitchen, your living room, the studio here, there's a tap, everywhere you are, flogged with water. You take your mop, take everything, and you clean the water without turning off the tap. You've not done anything. So when we feel feverish, when we had fever, when the body is hot, and we take some drugs, and it takes care of it, you take it around this time, 9 o'clock, and then by 11 or by 12, you feel, have you taken the drug to make the body worse? What happened? You take it again, or you take it sometimes, nothing happens. You are just mopping the water without turning off the tap, which means, what is the cause of that? Typhoid fever is very, very,
it's common.
And not just common, it's treatable. You can treat it.
Discovered early.
Yes, even at a very high stage, even the one I mentioned where you have typhoid perforation, that one would need a surgery by a highly specialized set of surgeons that will have to look for the area of, which is not easy, and close it. Now, it is treatable, but what I will advise is that I go by the adverts of some of our people that say, tí ibà náà bá lọ lẹ́yìn ìjọ mẹ́ta lọ rí dókítà rẹ̀. I would say, go to the hospital. àìsàn tá à ń sọ yìí ó ṣe é wò ṣùgbọ́n ní gbogbo ìgbà tá a bá ti rí pé nǹkan ò rí bí ara wa ò rí bó ṣe ń rí tẹ́lẹ̀ ẹ jẹ́ ká gbà lé ìwòsàn lọ wọ́n á ṣe àyẹ̀wò à á sọ fún wọn wọ́n á fún wa lóògùn a tún lè padà síbẹ̀ àwa èèyàn à ń ṣe àṣìṣe kan tá a bá lọ sí ilé ìwòsàn kan tó fún wa lóògùn tí lẹ́yìn ọjọ́ kan ọjọ́ méjì kò rí bẹ́ẹ̀ à á gba bòmíì lọ ibòmíì tá a gbà lọ yẹn ó ṣẹ̀ máa bẹ̀rẹ̀ láti bẹ̀rẹ̀ ni ibi tá a lọ tẹ́lẹ̀ yẹn ibẹ̀ ló yẹ ká padà sí kí wọ́n lè wo bó ṣe ṣe ó ṣe é wò dáadáa.
Now, Dr. ALADESUIRU,
Yes.
this brings me to another question. What are the dangers of self-medications without test?
Very nice, very nice question. The dangers of
Self-medication.
very terrible. I still like something about now because people are talking about Trump, about America. If you are used to their container with which they give drugs, whether liquid, whether semi-solid, or tablet or capsule, is always written there. Please make sure you finish the content of this container. What I mean by that is that if you are given a drug to be taken for 3 days, for 5 days, for 1 week or more, by the time you take it faithfully for 2 or 3 days, you feel like everything is okay. And then our people will stop. We're talking about self-medication. We've had some discussion here about the tummy. When we talk about it, there are about 8 different organs there or more. To recapitulate, we have the stomach, we have the spleen, we have the pancreas, we have the gallbladder, we have the liver, we have the intestine that is divided into about 4 parts. You have the small intestine, you have the large intestine, you have the one ascending, you have the appendix, and all this. Any of this one can be diseased. Any of this can be the one. So if the drug that is given to Mr. A, Mrs. B, or so, which he or she took and found okay and kept some other, this was a drug that I was given, let me give you, or you go to the chemist and they tell you, I'm opportune today again to mention what people call akakpo. It's the deadliest thing they will do. It's like someone who is hungry. He needs food. They give him a slice of bread, a morsel, one akara, one morsel of eba, one. Yeah, those all might do, but that of drug is worse because they give you so many things that would. It's not good. Self-medication is very bad because we do not know exactly. When I mentioned the various organs in the abdomen, which are people called inu, and you do not differentiate which one it is. There are specific drugs that go for specific organs and for specific ailments. Self-medication is very bad. I had this last time. This was a drug that the doctor gave me. I have a similar thing, and this is a drug that I'm going to use, does not pay. Please see a doctor. If he says, go ahead and take that drug, you are home and dry.
Okay. Thank you very much, dear viewers. I know you must have gained something this morning talking about typhoid fever. Trying to say that cleanliness is one big thing you need to do. You have to be clean. Your water, boil it. If you cannot get, in fact, some of the sachet water we are taking is not even the best. So I think the best is just to boil. Abi, doctor?
Yes, if you have a very good source of water, you don't need to boil.
Okay.
For some people, if you have a well,
Treat it.
yes, if you treat it, go to the water corporation. They were coming to treat it for us in those days. There are some chemicals they will pour into it and ask you it's going to last this number of weeks and then it will be done again. Those ones are very safe, but there are even people preparing the sachet water. If you see where some of them, they know that you have to sieve this water with cloth, muslin cloth. If you see the rags that some of them use, you will not try any treatment. There are some bottled waters that are also infected, that are done by people.
So the only thing is just to be sure you yourself. So don't just over trust some of these waters. Then your food should also be clean. Then when you have any symptoms, the best thing for you is just
And washing of hands.
Washing of hands. So don't forget. Truly, we are not witnessing Kuru, but then there are things bigger and stronger than Corona. So we need to wash our hands always and make sure things work out very well. So neatness, cleanliness is next to godliness. Thank you very much, Dr. ALADESUIRU, for coming.
Thank you for having me.
We really appreciate you, and next time when we call you, want to oblige us.
Yeah, sure. God willing.
Àdúpẹ́. So ẹ̀yin èèyàn wa ẹja kọjá lọ sókè lọ́hùn-ún ká tún lè mú àlejò wa mìíràn wọlé ẹjọ́ gbogbo tí dókítà wa ní ká ṣe oníkàṣe tẹ́bádẹ̀ tí rí para ti ń gbóná ẹ lọ rí dókítà ẹ má kàn kà pọ̀ mọ́ Ọlọ́run ò ní bá tiwa jẹ́ o.